Hello everyone. Today we are going to discuss about cardiomyopathies, or these are the disorder which cause the functional or physical changes in the heart. There are the restrictive diseases which hamper the function of the heart. First of all, let's discuss hypertrophic obstructive cardiomyopathies or hypertrophic cardiomyopathies. This is caused by the mutation in the myosin gene, which is present in the chromosome number 14, which causes the decrease in the volume in the left ventricle. Let's have a look on the pathogenesis. First, this one is the left ventricle, and this one is the right ventricle. This is the normal structure of the two ventricles of our heart. This is right and this is left. Now let's have a look of the abnormal side. In the cardiomyopathies, the left ventricle reduce its volume. The interventricular septum in the normal side is normal, but in the cardiomyopathies the interventricular septum dimension increases by almost double increases. That's why the volume of the left ventricle, this is left ventricle LV, this is right ventricle RV. Blood comes from the right atria to the left atria to the left ventricle and pushes it to the aorta. This is aorta. Now in the normal side, the blood comes in the left ventricle and pushes in the aorta. Normally about 80% of blood ejected to the aorta, but in the left ventricle of in the hyper obstructive cardiomyopathies, the amount of blood reduces by half due to the obstruction in the cavity of the left ventricle, and it become on the chest X-ray, it shows the banana shape. This is now clinical feature is this is most common in the between the age of 10 to 20 years, mainly affected male. Early symptom is dyspnea because of the amount of blood which needed by the body hamper, and the amount of blood reduces by half. That's why the feature of the hypoxia or maybe dyspnea. Chest pain is the most important factor because of the cardiac myocyte ischemia. Cardiac ischemia, and this is the most important factor to the sudden cardiac SCD. SCD stands for sudden cardiac death. Most of the people said that the any person of cardiomyopathies maybe died suddenly due to the deficiency of the amount in the left ventricular ejection volume, but this is wrong. The main cause of the sudden cardiac death is ventricular fibrillation due to the amount of blood reduces. While on examination, we see let's have a look on the heart sounds of normal heart sounds of our body. S1, then S2, then S1. We plot a graph on x-axis and y-axis, x-axis and y-axis. Normally, when during the S phase, the spike shoots. This one is the atrial contraction, which forms the anacrotic notch. This notch is, which I am highlighting, the anacrotic notch, and this one is dicrotic notch. This is normal. But in the cardiomyopathies, which I am highlighting through the green color, first it shoots spikes and gradually decreases and forms. Uh, this is because the in cardiomyopathies the force of contraction higher, HOCM power is higher. As the power increases, the power reduces by itself, also reduces. Early rise and early fall, early rise and early fall. While on investigation, we see through the TTE, transthoracic echocardiograph, echocardiograph, uh, through which we have seen banana shaped cavity, banana shaped cavity, which I have highlighted earlier. Let's have a look. This one, which I am highlighting blue. On ECG, we determine the left ventricle hypertrophy. It increases dimension by up to more than 30 mm of interventricular septum, IVC, interventricular IVS, interventricular septum. Treatment may be, drug of choice is propranolol. We have to reduce the cardiac activity, so that's why we have to give propranolol, as it is a beta blocker. It reduces the workload of the heart contractility to give the sufficient amount to relaxes, which causes decreased heart rate, decreased oxygen consumption. Second one is we have to reduce its cardiac contractility, so we have to give calcium channel blocker, which act on the SA node or AV node, which causes AV nodal delay conduction. So the current, this is SA node, this is AV node, this is Purkinje fibers, right bundle branch and left bundle branch of the heart. So as to it blocks the conduction of the impulse through the SA node to AV node. So contractility may be reduces. So third one is disopyramide, which causes LVOTO, means left ventricular outflow tract obstruction. That's it.